breeding season and foaling are some of the busiest times and most rewarding for thoroughbred breeders. Join us as we go behind the scenes in a number of stud farms to learn all about the foaling process, from preparing to foal, assisting and aftercare.
Well, my family are basically dairy farmers, or were dairy farmers, and I always had a passion about the horses. So I started off with a couple of sport horse brood mares and then moved into national hunt mares. And we've gradually gone from 2 up to, I think we have 11 now. We try and foal the mares as early as we can, and they spend their first 2 or 3 months here and then move to the farm. So they live at the farm until, I would say, they're maybe 3 weeks off foaling, and then we bring them home and get them used to the foaling boxes. And normal years they're out every day on the grass, but this year has been horrific. And they get out when they can, and if not, they're in the corrals.
So talk to me about what you might be looking for when those mares are 1 or 2 weeks away from foaling. You said you bring them on, you get them used to the foaling boxes. What sort of signs then are you keeping an eye on and looking out for?
Well, we watch their udders, and for when they start to slip, and you sort of see this tail head rise, and I sort of handle them every other day and feel how soft the bones are. And as soon as I reckon, you know, you get to know the mares. Mm-hmm. The first timers are always a little bit different, but you get to know the ones that, how well they fill up, and do they wax or do they not wax. And I use the sew-in alarms. So really, once they get to their date, even if they're not looking ready, I would put the alarms in. But we've been lucky enough over the last 3 or 4 years, since we used the Equiloom, that they nearly all foal to date. Okay, so this piece is stitched into the left side of the vulva, and there's a little stitch on the right side of the vulva which goes through this piece of suture material that's attached to a magnet. So when she foals, the pressure from the feet separates the two, and the magnet is pulled out and rings my phone. So we would sew the alarms in about a week before, when the udders are full and when they started to slip, but before they wax. And if I see a little bit of wax in, immediately they're in to get the alarms in.
And then tell me about, would you keep record books each year to be able to kind of track everything?
I do. I just, I have a big file that lives out at the crush, and everything we do with the mares, every time they're dosed, every time they get an old trace, it just all goes into the book. So I keep a note every year of their due date and the dates they foal. Do they carry over with a colt or a filly? And generally there's not a lot of difference in that, but some of the mares always foal maybe 2 weeks early, mm-hmm. and at least you're aware of that. The foaling boxes we clean out to the floor after each mare foals. They don't get power hosed out each time because it's a huge job, mm-hmm. but we do put lime down. Mm-hmm. And if there's been a problem, then they would get power hosed out. They get power hosed out at the end of the year. So we try and give the mares maybe 3 weeks to build up a bit of immunity at night in the box they're going to foal in. They all get vaccinated. They're all fully vaccinated for herpes and rotavirus. The rotavirus is expensive, but since I started to do it, touch wood, we've had no problems.
That's it. And then I suppose you've done your 1 to 2 weeks, your mares are then, you're almost a few hours away from foaling. What do you do to help your preparations? Obviously they foal at night. And then what signs are you looking for imminently before they foal?
Well, as long as the mares are settled and they're eating, I don't worry too much. They have the alarms in and with the cameras on. They're checked at bedtime, and if I wake during the night, I look at them on the cameras. But other than that, generally before they foal, they either stop eating or they walk the box a bit or they dig, and you sort of know the ones that are going to foal. I would say to Chris, don't go out. I do tend to bring them in early if I think they're on top of foaling. You know, rather than leave them till 6 or 7 o'clock at night, I bring them in at 3 or 4. And I don't know whether it's just in my head, but then they seem to foal sort of 11 or 12 rather than 3 or 4 in the morning. If the alarms are sewn in, the minute the feet come, it rings, the two of us, and we hurry out. And provided the feet are there, I cut the alarm out and let the mare lie down and get on with it. Once she has sort of presented the feet, I would put gloves on and just check that the head's there, everything's in the right position, and then let her get on with it until she sort of gets the head and the feet out, and then we always give her a bit of a pull.
I think it's kind of a similar consensus across everyone is not to jump in too early. Let the mare have her time, because it's that getting up and down that gets the foal into position. Can you talk to me a little bit about the correct positioning of a delivery foal?
Well, we love to see the 2 feet coming always one in front of the other, and the nose, and hopefully nothing else. Sometimes if there's just 1 foot flipped back, it's very easy to just straighten a foot or lift a nose. If they're upside down, it's a little bit more difficult just to try and maneuver them round, but we would try and get them turned round. We've been fairly lucky here, touch wood, that we had one this year, a terrible presentation, but other than that, we've been fairly lucky with mares foaling. That healthy foals generally tend to have themselves the right way up and the right way round. If the mare's healthy, that's number one thing. If the mare's not healthy, you're nearly always going to get a compromised foal. So that's the first thing you have to bear in mind, that you have to be prepared to look after a sick foal if the mare has been unwell. If they're unwell, it's always a good idea to run a blood, just see where you are with her. The bloods do tend to be a little bit crazy when they're foaling, but you'll always pick up an infection. And some of us, I myself have been lax sometimes and I haven't done a blood when I should have. But I think that's important. We have a good practice beside us, sovereigns that would run the bloods and give a good service that way. If we run into difficulties, it's generally a fact of having to run down the road, and then you've very little time to make up your mind. I always say at the first sign to somebody, if you know there's going to be a problem, get to a hospital where they can deal with it, because with all the best will in the world, if something is badly wrong, you're not going to manage at home. Once they foal and everything's good, and we would tie up the cleaning for the mare, make sure she's reasonably comfortable, and we would then leave them to it for an hour, just 1 hour. I would rub them over, make sure that the mare's licking the foal and everything looks normal, and that hour is sort of your time to get out there and get them up. We would then make sure that the foal has stood, get the circulation going, you know, whether we have to lift them or whatever. Most of them are up. I'd be disappointed if they're not up by an hour. Then we start, and you want to get to bed, so you want to make sure they get a suck. So this is where most of the rows start. Don't push it in, do push it in, don't push it in, do push it in. But a good healthy foal, we would hope, would suck within 2 hours. If they're not showing any interest in sucking, that's when we start to worry. I would start to worry at 2 hours if they're not showing any interest in sucking. I would have a listen to their hearts, and I would then start to think maybe they'll suck a bottle. If they won't suck a bottle, or they won't suck your finger, you begin to think then that maybe that we've got a bit of a problem here. And I would go in then and start the foal on an antibiotic, and I would give them a shot of Dex, just 5 cc of Dex. in case you're getting a dummy situation, and it'll stop the brain swelling. And very often, after half an hour, the foals just turn inside out. They get brighter and start to suck. That's fine then, we're happy, we get them sucked. If it goes on a little bit longer, then we do start to worry, thaw the plasma out, and you think, right, we're in for the long haul here. But again, a lot of them in 3 or 4 hours will then have come round and they'll suck. The mares at this stage, I'd like to have them cleaned. I used to just give a shot of oxytocin routinely. I'm more reluctant to do that now. I just put a little bit of pressure on the membranes and try and get them away. I do try and be about so that they don't trash them through the bed, to check that we have the placenta in one piece and there's nothing left behind. If I give oxytocin, I tend to give a bit of pain relief as well, so that the mares don't get uncomfortable, and if they're uncomfortable, then they're less careful of their foal. We would routinely give a foal a little enema, always, just as a matter of routine. That's one of the first things we do. I just use a Microlax, quick, easy, and not stressful to the foal at all. If they don't pass the meconium with that, if we have to, we go with acetylcysteine, but I do keep the foals topped up with a little bit of Buscopan, so that they do keep sucking because they're not uncomfortable, and you hope that the pressure will help nature get on. And I do notice that it takes them a little while to work up, are they trying to pee or are they trying to poo? And they don't really know themselves, so we're always relieved when we see that they've had a pee and that the meconium's away. If we're suspicious of a ruptured bladder, we'll take them in and get them scanned. And
what sort of symptoms would you be seeing if they had a ruptured bladder?
Well, you get a bit of distended belly, and they're uncomfortable and they're not passing urine. You would maybe see a bit of leakage of urine through the urachus, and I don't like to see that.
And then moving on to the mare kind of complications following her, so maybe looking at colics, if there's any retained placentas, what sort of things do you look out for there?
Well, first of all, we make sure she's comfortable and that she's not after pains, or she's not colicky after she foals. At any sign of pain after foaling, I do jump in quite quickly and give pain relief. Even something as simple as an oral packet of bute is often enough to just make them comfortable enough to look after and nurse their foal. We check the placentas, and then we just check for discharges. I do tend to put them in the crush after a couple of days and have a look that everything is easy, because I have the scanner sitting there. Very easy to say to do this, not so easy when you're 20 miles away from your vet. And again, the mares will tell you themselves if they're not right, and they should start to eat. You know, they're usually ravenous after the foal. Even the ones that have been picky beforehand suddenly decide, actually, I'm really hungry now. So if they're off feed, I worry, and just bloods, check temperatures, check heart rates, and I repair the castlicks very quickly. In general, I just repair them maybe halfway down to make sure that we don't get any infections in around the perineum, and keep her clean. I'm quite particular about washing the tails after they foal. I can't bear a mare with a dirty tail. I just think you're just setting up problems for yourself.
Foals just suck from everywhere.
Yeah, they do, and then the mares are whipping it around their vulvas, and they're, you know, if they're dirty, they're dirty. And you then see if you have a discharge, you're more likely to pick it up. Again, when we're giving them the enema, we give them a little spray of iodine, and I sort of spray them for maybe a couple of days. Just if they're wet at all, I would keep spraying, and I always keep a check on the navels. Quite a bit picky about that. And we keep them well bedded when they're born. You know, we move the mare to one side of the bed, and we lift out all the afterbirths and the wet and everything and rebed. We're lucky enough we've got big foaling boxes, so we can just move the foals about, and they're left that night with a nice clean bed. I think that's half the battle.
Perfect. And are there any other just kind of simple things maybe that you've picked up over the years that you're like, this has really made things easy, or this is just a...
Pre-worming, make sure either test your mares, preferably that's the ideal thing to do, or we do tend to give 5 days of panicure in the last 3 weeks before foaling to make sure we've no encysted worms, we're not passing a worm burden onto a newborn foal. I also vaccinate for tetanus in the last 3 weeks to try and build up the immunity in the foal. I then don't tend to give anti-tet a lot. If your bottle of anti-tet is open for a day, it's no use to you. So you're better to have your mare protected, make sure your foal has colostrum, and a good idea to check your IgGs at maybe 2 days. And if you're not happy with the IgG, we go with plasma.